Hey guys, it's your pal Dr. Sal again. Hope your day is going great. Today we're going to take a look at Cymbalta, also known by the chemical name Duloxetine. Now Cymbalta is a very useful drug. It's the Swiss Army knife of medications because it's so multifaceted. It's been licensed for use in depression. It's been used for generalized anxiety disorder. It's been used for diabetic neuropathy. It's licensed also for treatment of fibromyalgia. It's also licensed for treatment for chronic lower back pain and even lowly osteoarthritis of the knees. So it's a particularly useful drug, especially if there's intersection between these different disorders. So for example, if you're suffering with depression and osteoarthritis of the knees, or generalized anxiety disorder, and you've also got chronic lower back pain, well, guess what? We've got the drug for you. It covers both, so you can kill two birds with one pill. So now let's look at the potential side effects. Now, because Cymbalta is so widely used across a spectrum of different disorders, there was actually a study of people on it for depression. There was a study for people on it on anxiety, a study on diabetic neuropathy, a study for people on it for fibromyalgia, etc. However, when I looked across the spectrum of different studies, the incidence of the different side effects listed here, the most common ones, was pretty similar across the different studies. So they basically rhymed. The numbers weren't exactly identical, but very close. Now, so I chose the depressive arm, so people using it primarily just for depressive mood disorder. And in that study, the participants was 1,139 as opposed to 777 on a placebo. So the first most common side effect by far was nausea, which was seen in 20% of people as opposed to 7% on a sugar pill. So about 1 in every 5 people noticed nausea. The next most common down was dry mouth. That was seen in 15 as opposed to 6% of people on placebo. Insomnia, 11%, and constipation, 11%, as opposed to 6 and 4% respectively. Next up was dizziness. That was seen in 9% as opposed to 5% on placebo. So you can say the real incidence is probably more like 4%, not very common. Appetite decrease was seen in about 8% of people as opposed to 2% on placebo. Feeling tired from being on it was seen in 8% of people as opposed to 4% on the placebo arm. Sweating, which can be quite annoying, was only seen in 6% of people as opposed to 2% in placebo. And nausea and vomiting was seen in 5% as opposed to 3%, so a true incidence of more like 2% or very rare. Now, while not common, I still took this breakout from the study for erectile dysfunction and decreased libido because even though it's not very common, it's very catastrophic for those who suffer from it. But it's not that common. For erectile dysfunction, if you compare this with the regular SSRIs, it's not terribly common. So erectile dysfunction was seen in 4% of male users as opposed to 1% on placebo. So that's only 3% incidence. And libido decline, which could be male or female, was only seen in 3% as opposed to 1%. So as you can see, Cymbalta is largely very well tolerated and very useful because of its wide spectrum of indications. So if you were suffering with some of these nuisance features, one approach I would tend to do, so for example, the nausea was overpowering. One thing I do with my patients is the dose of Cymbalta goes from 60 to 120 milligrams. So the simplest solution I find is usually start low, go slow. So instead of the typical start dose of 60, I might knock it back to 30. Or I might even start that from the onset if I know that the person in general has a history of being sensitive to meds. So I might start them at 30 milligrams, and then after several weeks, 2 to 4 weeks, if they're tolerating it fine, then I'll bump it up to 60 and beyond. Another potential strategy, if you're suffering with these problems, is basically just to break the dose up from the get-go. So if you go back and report to your physician that the 60s, say, give you a severe dry mouth that you can't stand, you could try splitting the dose into 30 in the morning and 30 at night. Normally, you just cluster them together as a single dose. But overall, I haven't, I can't think of anyone in my patient population that I've had to stop this simply because of a side effect from it. That might just be a recall bias, but I really can't think of any that I've had to pull off simply because of a side effect. And sometimes the side effects too, if you persist with it and take it for a longer period of time, your body can adapt to it. And then say the dizziness that you initially felt with the first couple days may dissipate and disappear and never return again as your body adapts to it. So ladies and gentlemen, that is Cymbalta or Duloxetine in a nutshell. Thanks so much for watching, and we'll talk again soon.
Thanks for watching. Get notified of new videos. Subscribe now.